And good morning and welcome to Sunday Edition. There's so much to talk about this week, and we're looking forward to the conversations. First, we're going to be talking about what's going on when it comes to our kids and getting the COVID inoculation. But first, we also wanted to mention that we have the latest from the Women's and Leadership Project. We'll be talking about that a little later on in the program. And then, of course, also our Salt Lake County Mayor, Jenny Wilson, will be joining us. So many discussions, so many committees, so many commissions that have been looking at what to do about the burgeoning traffic in our Wasatch Canyon. So we'll be talking with the mayor about that. Most of us have heard in the last couple of days just the surging numbers at Primary Children's Hospital, numbers and respiratory issues that we normally don't even see until way into the winter. And will it help now that our kids who are a little younger can get their vaccination? And we're very pleased to have Dr. Christina Lau, who is joining us, and she is going to be the face of a campaign that we are going to be seeing over the next several weeks regarding a physician's thoughts, a mother's thoughts about getting our kids vaccinated. And Dr. Lau with Mountain Star Hospitals, thank you so much for joining us today on Sunday Edition. Tell us how it came about that you ended up being the face of a campaign to encourage us all to get our younger kids vaccinated.
Well, thank you for having me on the program. Definitely when I was asked if I wanted to be part of this campaign, I was thrilled to do it, and I jumped in. I've been looking for ways how to use my voice to educate our community about COVID and COVID vaccine, and I think this was a terrific opportunity for me.
As I read the articles and saw the commercial, the public service announcement that you are involved in, I was struck by the fact that you told us all that you would not ask us to do anything regarding our children that you would not be willing to do with your children. And you happen to have a son who is in a little bit more of a compromised position than perhaps many of our kids are.
Correct, yes. My son was born premature, very little, and he also has a heart condition that is called tetralogy of Fallot. So definitely I was very nervous for him getting sick with COVID.
Many of us have been, if not surprised by, even a little dismayed by the controversy and the brouhaha that has been stirred up around getting vaccinations, and we're seeing it around the country. Some states have startlingly low numbers of those who have been vaccinated so far. I just got my booster shot the other day. As a physician, as a mother, are you as surprised as some of us are that there has been the kickback on the COVID-19 vaccinations?
Well, it does not surprise me because, COVID is new for us, right? We didn't know anything about it, and it's been only a year. So, and I think also the misinformation in the media has caused trouble for parents to believe in science, right? And that's the main obstacle that we're been dealing as physicians, trying to educate our parents and let them know that the immunization is safe and it's gonna prevent the kids ended up in the hospital. So it does not surprise me. It's very scary if you think about it. It's something that you don't know, and it's difficult to understand. And sometimes I tell the parents, "Hey, yes, this is kind of like a Star Wars movie, but to try to understand how the virus attack the body, how the vaccine work." So it is comprehensible that parents feel a little bit of hesitant on that.
Some of us might not have been as hesitant to have us, a little older, get the shots. But when you start thinking of your 5-year-olds, 6-year-olds, 10-year-olds, 11-year-olds now who are eligible to get the shots, we're a little protective, to say the least, of our kids. Are you convinced as a physician and as a mother for your son and for your patients that this vaccine is reasonably safe?
Absolutely. I mean, the data, the numbers that's coming out with the scientific studies done with this vaccine are amazing. I mean, this is a vaccine that prevent COVID in a 91%, and with very minimal side effects for the kids. It's just amazing to to get to that point, right? So I feel very confident.
I remember a statistic much earlier last year where the people at Primary Children's Hospital were just amazed. The RSV admissions that they would normally have in a wintertime were almost non-existent. And it was very interesting since we were all being so careful and we were social distancing, we were staying more at home, quarantining ourselves. What about this surge that we are now seeing? I know you're not with Primary Children's Hospital, but with our younger folks and these respiratory issues that normally we don't see for months until the middle winter months. What effect is that going to have? And what difference can the vaccinations make in these startling numbers now where even non-necessary, essential, emergency situations, surgeries are even being canceled right now?
Right. So yeah, we are seeing a big number of RSV going in the community. We don't have a vaccine for RSV. We have a treatment that is called an immunoglobulin that we give to premature kids to help them when they get to prevent that they get the RSV, but we don't have for all the kids. And the problem is that COVID and RSV can be exactly similar in the symptoms. So it is very difficult to differentiate one from another in some cases. So if we have the vaccine available for COVID, at least we are eliminating that risk in our children. And then we can kind of like treat more toward the RSV infection, right, that they are having in the community. But I think that would be a great benefit. The RSV is going around because certainly the virus didn't die, right? So we were wearing face masks and we were doing hand washing and all that last year. And it's true that the cases were very low, but the virus did not die. The virus is around. Now that we are kind of like being a little bit more relaxed in the protections, then the virus is just spreading in the community. And COVID vaccine will help us to at least eliminate that big factor. And then we can focus on the viruses that, as pediatrician, we know how they behave, we know how they go in our community, and we feel comfortable taking care of.
Dr. Lau, maybe I could just ask a final quick question of you. You mentioned in the PSA that many people do have very legitimate questions. There has been so much misinformation, sadly, regarding the vaccines. Where can people go to get the proper information and to find out how they can get their child immunized?
Oh, that's a fantastic question. The American Academy of Pediatrics, go to the website of the AP, American Academy of Pediatrics, and all the facts and truth information is in there. Is the American Academy of Pediatrics is a wonderful organization that works for kids, right? Work for our children, and you're gonna find everything in there. That's a great place for good information.
Doctor, we certainly appreciate your time with us this morning on Sunday Edition. We wish you, your family, your son well. And coming up, we're going to talk about a study out of Utah State University. This will be the first of 5 briefs, and what it's telling us about sexism in our society and the opportunities for women to move into leadership positions. That's coming up next. There's a new report, a brief that is out from the Women and Leadership Project at Utah State University. This brief in this series that we're talking about today is the first of 5, and we really appreciate one of the authors of the brief, and that's Robin Scribner, joining us on the program this morning. Robin, again, thank you so much for your time, and maybe we could just back up a little bit. Tell us about the project for those who are not up to speed on it and what it is meant to discover and accomplish.
The mission of the Utah Women in Leadership Project is to strengthen the impact of girls and women across the state of Utah. And we do this by providing great research, wonderful events, and providing and sharing resources throughout the state. So it's a wonderful organization.
Many of us have been very conscious of this, hopefully for some time now, that there are even not overt things, but even almost subliminal things, kind of the mortar between the bricks, as it were, that just is almost like part of our fabric and part of our society. And many of us who are saying sexist things or implying certain things are not even fully aware of it. And one part of the study, women ignore or minimize sexism they experience. Many women do that. That's extremely interesting. They downplay it. Why? Are they afraid of backlash? Are they afraid of being singled out or limiting their potential?
It's a combination of all those things and even more. One of the reasons why we did this research project was, first of all, to understand the kinds of comments that women were hearing, but also to provide tools for women to have better ways to respond when they do hear sexist comments. So one of the reasons why women minimize or ignore the things that they heard is because they're shocked. They're not really sure how to respond. And so we're hoping to provide some great tools and typical responses that women can use that will be effective in hoping to minimize the types of sexism that they hear all the time.
Most men who are out there, and again, this from your report, are supportive of advancing, or at least think that they're supportive. But of all of the things that you were asked, do you agree with or disagree with, the most who disagreed with the statement is that most men are supportive of the advancement of women in, name the circumstance, the workplace, whatever it might be. I have to admit that surprises me just a little bit, but maybe I've got some blinders on.
Part of the issue is there's a disconnect between what men think they're doing. We know that most men have great intentions and that most men want to be supportive of women and the things that they're doing. But sometimes they're not necessarily doing the things that support women the most. And often there are unconscious things that they're saying or doing that are actually hurting women, and men aren't even aware of it. And that's another purpose of this study, is to help men understand some of the things that you're saying and doing, not necessarily helpful. Here's why, and here's what to say instead.
I'm curious to follow up on that just a little bit. What are some of the things, maybe the 3, 4, 5 worst things that otherwise fairly well-intentioned men are doing and perhaps not even aware of it?
Well, one of the examples that really falls into that category is what we call benevolent sexism. And this is when men do something that they think is helpful and it's actually hurtful. One example of this in the workplace is when a manager might say, oh, we're not going to give Robin this upcoming assignment because we know she has a couple of young children and that wouldn't really work out for her. But they don't ever ask me what I want or what I need. And so that ends up hurting me when they're actually trying to help.
One thing that I've wondered about, and I've been in the workplace, quite a while, and I've noticed some real changes. I've joked that some of the old movies that we watch and we laugh at now, I saw that in the workplace. The movie Anchorman, for example, in a broadcast facility, some of the crazy things that happened, it's meant to be a comedy, but in some ways I think it's almost a documentary. But I've seen remarkable changes in the workplace in which I have functioned now for a long, long time. And I recognize we certainly aren't there. We certainly haven't hit the perfect by any long shot. But have we, as you look back over the last 20, 30, even 40 years, have we made significant progress?
Absolutely. And one of the things that we see when we do watch those shows like Mad Men or Anchorman or things like that is we watch them and we say, I can't believe it was ever that bad. So that is a step in the right direction. But again, the purpose of our study and other research and conversations like this is to say we have made some progress, but we've still got a long way to go. The workforce is almost half women. And we have so many women in the state of Utah who are working. And so we need to continue to make better changes so there's opportunities for advancement and so our workplaces get stronger. And of course, this isn't limited to work. This happens at church, in our neighborhoods, in our homes, everywhere.
I'm glad you mentioned church. The Church of Jesus Christ of Latter-day Saints has such a profound position here in the state of Utah. Did you notice a difference between women who are members of a particular faith and perhaps profess more religious beliefs than maybe some others did? Is there a difference in the perception of sexism or the tolerance of sexism?
There is. We did notice a slight difference between that, between members of the church and women who were other Christian faiths or no religion at all. Even though women who were members of the LDS faith did say, I hear sexist comments a lot. They were less likely to say that than women of other faiths or no faith. And so there is a difference in perception, although a lot of the comments that we received did reference church settings, specifically LDS church settings. So there is a lot to unpack there. And we don't have enough data to know exactly what it means, but there are some interesting findings that we're going to be exploring in subsequent briefs.
Robin, we could talk for hours about this issue. I so appreciate you joining us on the program. But a final thought, again, we're anticipating more briefs, more information, more from this study, more from the efforts that you have underway. But what would you recommend for people who are genuine in their heart and they really don't want to be sexist, they really do want to improve? What would you recommend?
The number one most important aspect of fighting this type of sexism is open and honest communication. So if a man says, I want to be more of an ally to women at my workplace or in my community and in any area that they're interacting with each other, the first thing to say is, come to a woman that you trust and know and say, I want to do a little bit better. Are you willing to tell me when I say something that's out of line or inappropriate? And then you have to be willing to not be defensive and really listen. So that open line of communication and making yourself a little bit vulnerable will go so far in working to combat this type of sexism.
Robin, I certainly appreciate you joining us on the show. I look forward to future conversations where we can discuss the other briefs that will be coming up. Thank you for being part of Sunday Edition. And coming up next, we're going to talk with the mayor of Salt Lake County about the future of our Wasatch Canyons. Stay with us. We're very pleased to have the mayor of Salt Lake County joining us on Sunday Edition this morning. And Jenny, first of all, thank you for being with us. And you and I have been around long enough, and I cannot even enumerate the number of commissions, organizations, associations, committees, grassroots folks, business groups, Ski Utah. I mean, it goes on and on. The discussions on what should happen, particularly with transportation when it comes to our canyons and the overcrowding and congestion and pollution in our canyons, it is just mind-boggling. Are we anywhere near a conversation or decisions that really will start to make some things happen?
Well, I think the public's engaged, which is that's one of the good things. And you mentioned the variety of stakeholders and their commitment to the canyon. And it's because we love our canyons. Our economy is dependent on the canyon success. Our identity, to a certain degree, depends on the canyons that we love. And our recreation connection here as Utahns. And so I guess I understand it. To answer your question, I think we're moving forward a bit. The Utah Department of Transportation has come out with two options for consideration, and they've closed their public comment phase, and there were a lot of comments filed, we know. And the two options on the table, of course, are the gondola, an 8-mile gondola, or road widening. And I've stepped up and have some thoughts on those options. My partner in crime at Salt Lake County, Jim Bradley, a council member, he and I have been working on this quite closely and aligned on our concern over the gondola.
I remember so many years ago as part of the Salt Lake County Commission at that time, Commissioner Randy Horiuchi. I remember having the conversation on the air. This was about Mill Creek Canyon. We're primarily focused on Little and Big Cottonwood Canyons. But I remember Randy was really distressed, and he said, Doug, we are just loving our canyons to death. We have to do something. So in this case, the toll booth was put up, and that made a considerable difference in that canyon. Are we going to have to wait for a gondola or the widening of roads? I've heard tunnels talked about. I have heard rail talked about. Everything short of rocket packs to get us up the canyon talked about. But in the meantime, while we are waiting for some of those bigger decisions that will take years and years and years to accomplish, what can we do in the short term?
Well, that's where we landed, Jim and I. We think we could go through a process whereby we implement some common sense solutions. And frankly, the things that you mentioned, those big ideas, have been chased for some time. There was a lot of talk of a train. There was a lot of talk of a gondola, and now we're looking at a couple of options. But what we've done while we've been chasing big ideas is we haven't really implemented the common sense solutions that frankly would be needed no matter what we do. And that is build some good transit hubs. Let's upgrade our busing. We don't need to be running old buses up the canyon. There are solutions with clean technology, and those are developing and emerging all the time. What about scheduling? I like that the resorts are now looking at some parking solutions. I think there's some relatively easy things to do. Of course, they'll take investment, and I'm encouraging the state, once the decision is made by UDOT, to roll out some investment. I just think that we should do those things first before we build 262-foot towers, many of them. By comparison, the Salt Lake Temple is 222 feet high. Some of the towers are as high as 262 feet for the gondola. And that level of visual impact is one that I really struggle with.
Many of us are very concerned, too, about widening roads, putting in cement snow sheds along the road. And, boy, you do wonder when we make some of these rather dramatic changes in and to the canyon, what will be the long-term consequences of that?
Well, you're right, Doug. Whatever we do will be permanent. So I'd like us to slow down a bit. I hope that in an era where we do have some state money for one-time projects, some federal money, that we will dedicate funding to these short-term or initial phased solutions, technology being one of them. I think we'd all make different choices if we knew there wasn't a parking spot. I think we can get better at supporting a good busing system if we know it's going to work and they run regularly. We know no matter what we do, we need transit hubs. Let's build those. Let's get moving on those solutions. More investment in traffic management, just with maybe some appropriations of additional officers to help us get up and down the canyon. There are things we can do to make it a lot easier. And one point I think I need to make is I came to the table largely due to my love of the canyon, but also we had residents at the base that were so inconvenienced. The base of Little Cotton had been big, and residents are even now saying, wait a minute, we would take status quo over a gondola. That's not going to be a good thing for our neighborhood.
Right. Mayor Wilson, thank you so much for spending this time with us on Sunday Edition. We unfortunately are out of time. We'll keep a close eye on this issue. And Music and the Spoken Word is coming up next.